Yes, today we are talking about sickle cell anemia. Sickle cell, we can call it stick cell or we say sickle cell anemia. Sickle cell, this is a hereditary disease that affects the red blood cells, majorly on the beta glutamic acid. Some history about it. Actually, it was discovered in 1910 by a man called James B. Herrick. Was examining a slide of a dental student. So this man examined that slide and saw some sickle cell. Before we continue further, let us see something about hemoglobin, because red blood cell contains heme and globin. So we have the types of hemoglobin. Let us first see the types of hemoglobin. We have hemoglobin A, we have hemoglobin A2, and we have hemoglobin F. Under normal circumstances, these are the hemoglobin we have majorly in our body. Because an adult will have 98% of this. 98% of the hemoglobin we have in our body is hemoglobin A. Then hemoglobin A2 is about 2 to around 3% in our body of an adult person. Then this one is also around here, 2 to 3. This one is around there. This one's range from here. So they are little in an adult. Now in the fetus, again it is the vice versa. This one is too much, it's around 98% in the fetus, and the very newly born babies. This one is the same. Then this one is the one which is around 2 to 3%. So in front there we shall see the reason of starting with the hemoglobin study. This sickle cell disease is majorly usually it is affecting the blacker race. Yeah, the study has been taken all over the world. It was 7.7 million people suffering with sickle cell disease. But now it has changed. The new study says that there are 8 million people living with sickle cell disease in the whole world. And we did a study in America and found out that 100 people out of these 8 million, 100,000 people, these ones are from America. And we did a study we further did a study in America and discovered that in every 10 people suffering with sickle cell disease, 9 out of the 10 people with sickle cell, they are blacks. If he's not black, he has an ancestor from the black color people. So it is majorly for black people. It's only because the ones who are not black, they only take attendance. Majorly, what is affecting much, what they have, these whites, what they have mostly, for us we have sickle cell. For them, they have what we call thalassemia. It disturbs them so much, but with the time we are going to study about it. Just subscribe and keep in touch. Signs and symptoms. Signs and symptoms of sickle cell disease or sickle cell anemia. Now, the first sign, the cheeks will look like they are deformed. Extended cheeks. Then there will be yellowing of the eyes, jaundice. Yellowing of the eyes. These people, they usually complain of too much pain, especially in the hands and feet. Usually they get anemia. Usually they are anemic, and their level, their red blood cell level, it is always not in the normal level. It is always below the normal range. So there will be swelling of the fingers and the feet, swelling. Of hands or fingers, and the feet. Then also they will be having stroke. They have bacterial infection, or usually disturbs them. Infection is like streptococcus. Then there is Neisseria meningitis, like that. Usually they disturb them. What causes this? Now you see, if you have a parent, if you have a parent, this is the man, and this is a woman. Now, to make a zygote, when they mate, they make a zygote. So, to make a zygote, they have to mate. And when they mate, they will have to, this one will bring his egg, and this one will have his egg. This is an ova, this is a spermatozoa. Now, this spermatozoa is divided to the characteristics. So this one, it will have this side maybe, if it's a carrier, it means this side will be normal, this side will be a sickle cell carrier. This person will also be, if let's say it's also a carrier. So you will have one side sickle cell, one side is normal. So this one will come, it will divide, this over will divide, and it brings a half of this. So a half of this, which is, this one is S, sickle cell. This one is of sickle cell also, if it comes and joins this one will join here to make a full fetus. So this zygote, which develops into the fetus, is having S from the mother and S from the father. So this person will be a sickler. So is having sickle cell because he got sickle cell from the mother and the father. So if this time they were mating and this normal side came and joined with this sickle cell side, it means that this person will be a carrier, not a sickler. This one is a carrier, this one is a sickler, but they are of the same parents. And actually, if this one comes and joins with this one, it will have a normal and a normal. So this person will not be will neither be a sickler or a carrier. This person will be a normal person, will not have sickle cell, will not even have any trait of sickle cell. So this is how sickle cell comes from the parents and passed to the fetus. Now it has been passed to the fetus. What is affected such that some people get sickle cell and others don't get? What is the difference in their blood formation? Now, in our red blood cells, we have hemoglobin, and in this hemoglobin, it is made up of 2 alpha and 2 beta. It is these 2 which joins with these 2 to form a molecule of hemoglobin. So this is heme. So these 2 alpha will join with these 2 beta. So altogether they are 4 now. These 2 and these 2, they are all 4. Now, what is affected in the sickle cell person is this beta. 1 or 2 are affected. Now, 1 or 2 chains are affected in this one. What makes, again, this is what makes up this hemoglobin made out of heme. Now, in heme, we have 2 beta and 2 alpha. Now, again, what is affected? This one is not affected in the sickle cell person. What is affected is this one here, the beta, is the one which is affected. So, what exact part is affected? It is the 6th part, because what forms the beta is this one. They are joined like this. These are the chains which form the beta. Now this is number 5, this is number 6, this is number 7. Now the mutation on this one will cause sickle cell. Now this one is made up of the glutamic acid. Even this one is made out of glutamic acid. Even this one is made out of glutamic acid. Now, in a sickler, this part is changed, because in the sickle also we'll have like this. So this is our number 5, this is our number 6, this is our number 7. This one is glutamic acid. This one is glutamic acid. This one is also supposed to be glutamic acid. But in sickle cell, it deletes this glutamic acid and replaces it with valine. So this valine is weak. It cannot support the red blood cells. So what comes as a result? It is the red blood cell is supposed to be round like this. Now, because this one cannot support it to remain round like this, it will eventually fail to be round and be a bit crescent, and it will adapt a crescent shape, or it cannot be called crescent, it can be called sickle, like a new moon. So what is a sickle? Something like this, it is called a sickle. So hence the name sickle cell comes from here, because it forms the round cell to be sickle. So the cell is a sickle, so that is a sickle cell. It comes from the deletion here. They delete the glutamic acid and replace with valine. Dangers of sickle cell. Dangers of sickle cell. You find that the person having sickle cell will have problems like a stroke. This is the problem to the brain. Now, sickle cell, these are the veins. These are the veins taking blood to the brain. So it will reach somewhere and it branches. And this one goes this side. This one takes blood to this side. This one also takes blood to this side. So you find that red blood cells which are round will move smoothly and reach and take the oxygen up to the extreme end of the brain or any part where it is taking blood. But people who have sickle cell, what makes them get a problem here is that these ones are sickle. So when they come, sometimes they get clogged here. So eventually they block. They again instead block. They block the veins or the arteries. They instead block the vessels carrying blood. So blood will be prohibited to reach the brain if the brain is at this site. So blood might reach here. Even the small ones which are round might even come with oxygen, but it will reach here and find a blocked part. So it will not go through this blocked part to reach the brain. So eventually this will cause stroke to the person having sickle cell. Another thing, it is to the heart. It is a problem to the heart. It will also cause a problem to the heart in the same way as we have explained there. Blood coming to the heart may not reach very well, may be blocked, and it causes a heart problem. Even in the liver, the same thing. Even for the men, in the penis, it is the same thing in the penis. So all parts of the body, even the eyes, it causes a problems even in the eyes. So most parts of the body. Now you know very well that in the body there is too much breakdown of red blood cells. You know, red blood cells, they usually stay in the normal person. They usually stay in the blood for 120 days. But for the sickler, somebody having sickle cell, it stays only for 17 days. So there is too much breakdown or loss of these red blood cells. So since there is too much loss of red blood cells, the spleen which is responsible for filtering and working on these red blood cells, is overworked and overloaded. So the spleen will eventually become enlarged. So there is spleen enlargement or splenomegaly. Even in the gallbladder, the same problem. So those are the problems with the sickle cell. The complications of sickle cell. These are, we have called them dangers of sickle cell or complications. Diagnosis of sickle cell. The diagnosis for sickle cell, we can do a thalassemia. You make a thalassemia and stain with Romanoscar stains. Stain with it. With Romanoscar stains. Romano. There's a thalassemia stained with it, Romanoscar stains. Then we'll stain it very well, air dry, and examine on the microscope using the times 100 oil immersion oil. So that is one way. Another way, you can use solubility test. These ones we shall study one by one, and we come to know them one by one in our next videos. Then there is another test we can do. There is use of sodium metabisulfate. You can use this salt, sodium metabisulfate, and you can still get to know whether the person has sickle cell or not. But it is confirmed after 24 hours, this one. Then we can also use, there is a standard one we use, which is the use of electrophoresis. By use of electrophoresis. So these are the ways we use in the lab. Care and treatment of people. Care and treatment of sickle cell disease. Care and treatment of these people with sickle cell. These people usually get it, they are prone to getting diseases, so make sure you vaccinate them. That is care. Then they are usually having a lot of pain. So what you do, you work on the pain. So make sure you have the painkillers. That is treating. That is also care and treatment. So then there is, when you are treating, make sure you give a supplement of folic acid. If anemia becomes stubborn and continues, make sure you transfuse. You do blood transfusion. make sure you do blood transfusion. Furthermore, if you see that the person is having some problem, in case there is any disease, treat that disease. In case there is we usually with this sickle cell, usually we treat the signs and these other danger things, like if the anemia is dangerous, make sure you do the blood transfusion. So you give the painkillers, you vaccinate these people, you do the needful treatment according to the complaints, but you make sure the problem with the blood transfusion is that there is too much. The blood is overloaded with iron. That is the problem with it is too much blood transfusion. But nothing to do. We have to care for these people and they survive. So long as you contact the rightful person to give you help. Another thing, an addition here, there is a drug. Before we go to the drugs, we have they have developed a way of the stem cell treatment. It works on the initial part where the red blood cells comes from, so that they don't come with sickle cells. So another one is that it was in December around 2023 there, 2023, 2022. But it was December 2023 when they developed and approved a drug called hydroxyurea. This drug, it helps because we have seen that most of the children, the baby in the fetus and the newborn babies, they usually don't get any problem with the sickle cell, even if he is a sickler. Why? These babies, when they are in the fetus, they have hemoglobin, a type of hemoglobin. You remember we started this hemoglobin. So the type of hemoglobin which is too much in the baby is the hemoglobin F. The newborn baby has little of hemoglobin A and hemoglobin A2. So much of the hemoglobin which is in the baby or the womb, the fetus, much of the hemoglobin which is there is this hemoglobin F. And the sickle cell only affects hemoglobin A. Sickle cell affects hemoglobin A, and it is little in young children. That's why it is hard to see the signs and symptoms of sickle cell in somebody who is in the womb and the newly born baby. Usually, the signs and symptoms of sickle cell, they usually start at 5 to 6 months. It starts around here. But when it is 4 months, 3 months, 2 months, 1 month, week, these babies, they don't get any signs. Signs start at around 5 to 6 months. So this hydroxyurea, since they knew that the newborn babies, they don't get signs because they have this one, and we know sickle cell only affects the hemoglobin A. What we do, this hydroxyurea increases the number of hemoglobin F in the saturation, such that the person will resort to using hemoglobin F even if this one is faulty. So that is how it works. We shall see much in our next videos. That is it. We are asked for the start. Just keep around. Just subscribe to the channel. Dr. Peace Medical Lessons. Subscribe there. Give a like. Comment your question. Where you see you are not clear about it, just comment a question. We shall give you an answer. Thank you very much.